Well, my name is Kevin Nicholson. I'm the clinical administrator here at Ketamine Wellness Centers. And what I want to explain to you right now is essentially the process to both to become a patient here and what you would experience if you choose to go forward with our treatment and if it's clinically appropriate for you to receive treatment at Ketamine Wellness Centers. Upon arrival, when inquiring about care here at our clinic, we do a complete psychological as well as medical assessment utilizing different diagnostic tools from the mental health community and then doing a clinical review of a patient's health history and medication review to determine efficacy and benefit for the patient. Once it's been determined that the patient is appropriate for treatment, we'll set them up to come into the clinic for a series of treatments. When you arrive here at the clinic, we'll greet you at the front door and we'll have you, prior to treatment, perform a self review of what your symptoms, what you're feeling like that day. Once that's completed, we bring you into a room like you've seen in other videos on our website, and we'll get you set up with an IV. Put you on a heart monitor, blood pressure cuff, and a pulse oximeter that tells us how you're breathing through the treatment. The treatment on an average take about an hour and a half to an hour and 45 minutes for depression treatments. Patients who are struggling with neuropathic pain, it may be essentially double that, so 2 to 2.5 hours for those patients that are being treated for pain syndromes. Once the infusion is initiated, the patient will feel a sense of kind of a numbness or a heaviness to the body within minutes of the initiation of the infusion. Shortly after that, there'll be kind of a floaty dissociative feeling. Not hallucinations and not that intense. During the treatment here at Ketamine Wellness Centers, one of the things we pride ourselves on is that all the patients are constantly supervised, so you always have a trained medical professional in the room with you, working with you, making sure that you're comfortable and you're feeling the effects of the ketamine infusion, but it's not too strong or overwhelming for you. During the treatment, if at any point in time it feels that it is strong or whatever, all of the clinical team will adjust the dose and make sure that it's comfortable and we can make sure it's precision for your treatment. Once the treatment's done, we will give you some recovery period with a little bit of low-dose saline being infused over about 30 minutes of time. And then, because it is an anesthetic, legally you are not allowed to drive yourself home, so you will have to have somebody here to accompany you home. The only side effects that one can experience during the treatment is possibly some nausea. High blood pressure or hypertension can also occur. If it becomes problematic, then we can treat those symptoms also with a antihypertensive medication based on our protocols, which are prescribed under our medical director's supervision. No other side effects have been spoken about over the last 3 years of treatment. Afterwards, you may feel tremendously better. That evening, you may have some slight headache. Some over-the-counter type medications may help you. You also may have a little bit of difficulty getting off to sleep, but once you get off to sleep, you usually sleep very well. The best part of this treatment is within hours or within the next day, you may start to feel what it feels like to be symptom-free of depression or pain. So by doing a series of treatments over a two-week period of time, it can get a patient stabilized, and once stabilization occurs, then we start to increase the interval of time in between treatments. On an average, the patients who've been coming to us for the last 3 years are coming in every 8 to 12 weeks, getting a single infusion and continue to be depression or pain-free.